Dave Elliott. We're going to start with that, and joining us now, Singing River Health System's Dr. Jason Williams. Dr. Williams, thanks so much for being here. Let's start with what is becoming a major concern here on the coast, all around the state and around the country, and that is preserving hospital resources as hospitalizations are up. What are you seeing in the Singing River Health System in terms of what might be of concern?
That's a great question, and it's obviously been a concern since the pandemic started. We have had good fortune that our administration and our hospital leadership kind of got out ahead of it before we really got hit, even as far back as the winter and early spring. And we have been able to, for most of the pandemic, we've been able to maintain an adequate level of care for our non-COVID patients, in addition to being able to care for all of the very ill COVID patients that are here. So we have not been hit as hard from a bed availability standpoint and resource standpoint as some health systems around the country, but it's something that we meet about every day. It's something that our administration and our leadership is constantly talking about and talking to the physicians about, so that people like me who care for patients that don't necessarily have COVID issues but do have urgent issues that need to be taken care of, so we can still take care of our community in that way also.
Yeah, you're a thoracic surgeon, so you specialize on the heart and lungs. So what has been the impact from what you've seen of COVID? We know it is going to impact the lungs, but what have you seen as far as the heart and what impact we're seeing on the lungs from the disease?
Well, I tell you, the biggest impact, I think, of COVID with regards to cardiovascular disease is that patients are staying home and not necessarily seeking the care that they would otherwise seek if the pandemic wasn't happening. And I think that, and it's really impossible to predict this, but I think what we're going to see is that as the pandemic runs its course, we may find that there are more patients that are going to be coming in with delayed effects of cardiovascular and some other disease processes that have not been adequately cared for because the pandemic sort of had people staying home and trying to stay out of the health system in general because they didn't want to be in contact with COVID. Regarding cardiac manifestations per se, the biggest thing that we see in the cardiovascular space is that these patients can develop a lot of blood clotting problems. And so our critical care specialists and our hematologists have worked very aggressively on combating that in our sick or ICU level patients. And obviously there's the lung issues that our colleagues in the pulmonology department and the critical care services have been very aggressive at managing. But what we're seeing on the elective side of things is there's a bit of a downswing in the number of patients that we're seeing because people are staying home.
And they call it the novel coronavirus for a good reason. I don't think the scientists and I don't think the medical professionals have really figured out the nature of this particular virus. But what do you think is the correlation when we see numbers, positive testing numbers over 1,000 for 3 days in a row, and then things are down more in the 300 to 400 cases a day, and I'm talking about in Mississippi. What do you think is the correlation between activity, behavior, positive case numbers?
I think it's a really difficult question to answer, to be honest with you. I think that there have been periods of time, and we've had experts from Singing River in the past, like Dr. Roth and Dr. Bobber, discuss that there do tend to be periods where after holidays or after kids going back to school, things like that, there may be spikes, especially at the college level. But then that doesn't always correlate either, and I think it's a difficult question for infectious disease specialists to answer, and the answer may elude us forever. And what we may have to do is simply find a way, from a vaccine strategy standpoint and medical care standpoint, to try to eradicate the virus that way, because I just don't think we know enough about it.
And the basic message we've received throughout this pandemic has been hygiene, like washing hands, avoiding large gatherings, social distancing, wearing masks. There are mask mandates in effect right now in 15 Mississippi counties, including where you are in Jackson County as well as Harrison County. Do you reinforce all of those measures in terms of stopping the spread?
Well, certainly. I don't think that there's any reason not to be careful in this pandemic or in the basic cold and flu season that comes up every winter. The measures that we take in our hospital, if there are patients, families, or providers who have symptoms, we try to isolate them immediately. We try to avoid contact with patients that are high risk, and do our due diligence to try to minimize the spread in any way we possibly can. As far as the other epidemiologic strategies, I'll leave that stuff to the policymakers. That's not really my purview, but certainly when patients come into our offices, it's not only a policy in our practice, but also Singing River wide. We wash our hands, we wear masks, we try to maintain distance as much as possible from each other, so that we can try to minimize the spread of the disease, especially in my patient population, which tends to be folks who are older and have more comorbidities, which puts them at higher risk for bad outcomes with COVID.
When we look at the numbers from the State Department of Health, the age group that is showing the most positive tests right now is like in the 25 to 40 age group. But as you mentioned, more senior citizens, the death rate is still considerably higher in the 65 plus age range. What do we take away from those two things? First of all, the positive cases in that 25 to 40 group, and then as you talk about the most vulnerable, 65 plus.
Well, I think as far as the positivity goes, my comment would be an educated guess, but would be such that I think people are probably getting out more and interacting more, and that's probably where the positivity is coming from. As far as the elderly population, I think what we really need to focus on more than anything is trying to keep those patients at highest risk isolated. I think with a virus such as this, it's virtually impossible to stop the spread, probably until there's this concept of herd immunity that they talk about and things of that nature. I think it's in some ways going to have to run its course, but what we can do is we can take those at highest risk and we can hopefully isolate them to the point where as few of them become infected as possible. And what that basically means is, when you come home from college, you can't visit grandma and grandpa. And it stinks. I've got a college freshman right now who's not going to be able to see her grandparents at Thanksgiving. And it's unfortunate that that's the way it is right now, but I think that's the safest way to protect our elderly population.
Okay, from the Singing River Health System, Dr. Jason Williams, thanks so much for joining us, Dr. Williams, and best of luck to you and all the other healthcare professionals in the SRHS.
Well, thanks for having me.
All righty.
I need you right now.